My first visit with a nurse practitioner just really showed me that she wasn't afraid to get out from behind her desk and really participate in what your problem was.
They come in, they find out what's going on.
I just felt so taken care of.
Thanks to my nurse practitioner, I was able to escape a serious heart attack and possibly death.
And the nurse practitioners, if they're going to give you some drugs, they explain why, exactly what it's going to do, and much more helpful.
It was like talking to a normal person about personal stuff that she actually knows what you're going through.
The biggest thing about this whole thing, taking care of my mother, was the nurse practitioners made a big difference in her care and my sanity.
Nurse practitioners, the needed perspective.
Well, when I first went to go to the nurse practitioner, I was a little apprehensive about it, but no, she's been specially trained. My wife kept telling me, and so I did go to the nurse practitioner, and it was such a good experience.
Nurse practitioners are not the same as a doctor. They have taken extra training, and they have their own scope of practice in terms of what they can and cannot do.
I find the nurse practitioners work well as part of the team, and when they know their scope of practice, and if there's something that they need to refer, they do.
I was very pleased with the referrals that the nurse practitioner made, and obviously the cardiologists respected the nurse practitioner's observations because he got Richard in very quickly for the stress tests, and things moved very quickly after that.
Nurse practitioners have been at this clinic for over 10 years, and they were a fairly new healthcare professional when they joined our clinic. We were one of the first places in Saskatchewan to have a nurse practitioner.
Well, in the 3.5 years that we've had nurse practitioners here, we've realized 75% reduction in emergency hospital transfers. 85% of our elders are now on 8 or less medications, which we know to be best practice. The nurse practitioners, in consultation with a clinical pharmacist and the physicians, are quarterly reviewing medications so that elders have the right medications, are on the right medications, and not on ones that they don't need to be on. So in my mind, the role of the nurse practitioner in this kind of an environment in long-term care saves our system and our taxpayers and our elders the money that they need.
The early thoughts that I had as far as nurse practitioners were concerned was, what are they all about?
As a nurse practitioner, I'm unique because I've been trained as a nurse first, and you are taught to be very holistic in your assessment of the patient, all their needs, physical, psychological, and social. And in a nurse practitioner role, I have a more responsibility in assessing and diagnosing and following up those patients to make sure that they are getting the best that they can in the healthcare system.
I think the best part about my job is when a patient says thank you, when they feel that they actually been helped and heard. Lots of times it's a simple thing for me, but it's a big thing for them. And they walk out of here with a big smile and feel that they're in control of their life and they're feeling better about themselves and their situation. That makes my day. That's really why I continue on.
One of the big areas of primary care is accessibility. So by me doing an outreach clinic, I'm making health services accessible to those who maybe wouldn't be able to access health services. I have a lot of extra training that allows me to also diagnose and prescribe medications. So when a patient comes to see me, we discuss their medical history, we discuss their chief complaint, we take a good history from them, I do a physical examination of them, decide on which lab work needs to be done, if any, order those lab works or investigations.
My nurse practitioner has no problem saying either I don't know or I don't know enough. Either I will find out and get back to you, or let's refer you on to someone else who might know a little bit more than me.
As a nonprofit corporation, our resources are very limited when it comes to finding the appropriate resources for youth for whatever medical concern they might have. Obviously, we're not healthcare professionals. It's very hard for us to also figure out and navigate the system. Barb is able to quickly identify what the need is of the youth. She's able to refer to the appropriate specialist and also engage with our staff to increase their knowledge of what the youth needs. And therefore, it saves us an extreme amount of money in staff wages. Just guessing games and trying to educate ourselves on becoming our own professionals in a system that we're not really familiar with. She's able to break down all those barriers and ultimately save us a lot of money, time, resources, and for what we're good at with working with the youth themselves.
So we focus on a holistic approach to health and needs for the youth. It's a youth-centered model, so that all ties in together. Having the nurse practitioner as part of the team just provides the piece of the puzzle to that physical health care.
At first, when I first went to go see her, was to go get myself on birth control, the whole, you need to do this after you just have a kid, get prepared for the future and all this. But after that, it was more or less just go make sure I'm okay, go make sure everything's okay with my body, that I'm doing stuff right, that I'm actually taking the steps that she's helping me with. She showed actual, genuine emotion. When you're talking to somebody, it's not just person, customer kind of situation. It was more or less just, you need help? What do you need help with? I'm here, ask me anything. That was basically what she said. Just ask me anything and I will help you find the answer, or I will give you the answer if I have it. It was pretty nice, actually.
Nurse practitioners have been licensed with the Saskatchewan Registered Nurses Association since 2004, practicing autonomously and in collaboration with physicians. Our relationship is built around the mutual understanding and respect for each other's knowledge, skill, judgment, and the unique role in the healthcare system. Dr. Lotz, a family physician in Regina, describes the impact nurse practitioners have on his practice.
Resident care has become easier in terms of the nurse practitioners being able to attend to residents and prescribe treatment for certain conditions in between my weekly visits. Phone calls to my busy office have decreased, as NPs can attend to lab results promptly, avoiding time-consuming calls. I do believe the presence of nurse practitioners has improved communication, and in my opinion, this team approach would benefit other long-term care facilities.
Our nurse practitioners have a major role in this team.
Dr. Maroof, together with the nurse practitioner, manage Regina's newcomers' health. NPs work in diverse situations, urban, rural, remote, and isolated communities. Dr. Maroof comments on the nurse practitioner's essential role.
They are a great part to the health system. They are an asset to the health system in Canada because they have the power that they can do more and contribute more to the health system, because they put them in some places like emergency or some clinics or long-term places that they are underutilized. They don't know how much potential they have and how much they can do to make the healthcare to patients better in this practice. They are sometimes closing that gap that the health district have, that we are deficient in doctors and we are deficient in healthcare workers, because they can fill up that big gap that people talk about. They can work independently, you know, because they know the scope of their practice and they will go and practice according to what they have.
Well, when I look at the whole financial aspect of the system and how so much of our tax dollars go to healthcare, I know that by reducing the number of hospital visits or emergency room visits using ambulance service to the emergency departments, we're going to be saving money. So by 75% reduction just from our long-term care alone, we are saving the system and the taxpayers money that is much needed for people who actually need those services in emergency. The other thing we're doing is we're saving money to the actual elders and to the residents, because that part of a hospital trip, the total cost is borne by the residents themselves. So for people who are of limited income on pensions, that is a tremendous savings for them as well. We have seen the benefits of the addition of a nurse practitioner and how people's wellness has improved.
And I really welcomed the care that the help that I got from the nurse practitioners. I knew a lot about the system, but they really filled in a lot of blanks. They were advocates. They really gave me an insight into things that I didn't know in hospital care, medical care, and most importantly, the journey to the end. And that's where it really made a difference.